Therapy can be really helpful for anxiety. However, one of the first steps towards healing is to recognise that it's anxiety that's the problem in the first place. So this video explores what anxiety feels like in our minds, in our thinking, and the 5 different ways it can show up. This is part of my series about recognising hidden anxiety in different areas of our life. The first way that anxiety can show up in our thinking is through intrusive thoughts. Intrusive thoughts are defined as unwanted thoughts, unwanted images, unwanted impulses, and actually having these things in our head can cause stress. Sometimes so much stress that it gets in the way of somebody being able to function. For example, some people get intrusive images of something bad happening to them, or maybe something bad happening to somebody else. Some people get it that they might hurt somebody, or it could be about that they want to self-harm, or intrusive thoughts about questioning their sexuality. The important thing about intrusive thoughts, it's something an individual doesn't actually want to do. They're not aligned with it. It's not according to their values. And it feels like these thoughts just come out of nowhere and are implanted in their head. And they fight with them, and it can become really stressful. So these intrusive thoughts themselves are an indicator of anxiety. The second way that anxiety can show up in our thinking is through trying to be perfect, or we call this perfectionism. Perfectionism is a form of rigidity in our thinking where if we're not perfect, then we're a failure. So we call this all or nothing thinking. Often people can be perfectionists because they actually feel a lot of anxiety when they're out of control, or a lot of sense of unsafety if they don't achieve things perfectly. And this can go back to early experiences as well about, is it safe to do things not quite good enough, and their experiences of that. However, underlying perfectionism is really somebody who often feels quite anxious that they're not good enough, and that anxiety is driving them to be perfect. The third way that anxiety can show up in our thinking is through the rigid application of rules, our own rules to life. For example, you agree to meet somebody at a certain time, and that individual gets very upset if that agreement isn't adhered to exactly. There's no flexibility. Or you make plans to go somewhere and actually want to stop somewhere else on the way, but those initial plans have to be followed exactly without change. This kind of rigidity can sometimes point to anxiety and that person's need to be able to predict what's going to happen to help them feel safe. And when things change, they don't feel safe, and it creates anxiety. And sometimes it can create anger as well. Therefore, it's anxiety that's the underlying reason about why they might be so angry if you're late, or about why the plans have changed. And it's anxiety which is about their fear of things being unpredictable. The fourth way that anxiety can show up in our thinking is through focusing on a worst case scenario, and we call this catastrophizing, and engaging in lots of worry about that. We call that rumination. The rumination is when somebody goes over and over their fears, or maybe over and over a conversation or something that's happened, but it's really negative and there's no looking at solutions or ways out. It's just going over and over the negative again and again. It's normal to worry about things, but this worry can become out of control, particularly if it's fueled by a focus on the worst case scenario as well. The catastrophizing can take up a lot of time and put the body in a really stressed state. For example, it's really normal to worry about your first day in a new job and maybe feel a bit anxious. But if somebody's spending their nights going over and over what could happen, worst case situation, not looking at any positive things or possible solutions, we'd say they're stuck in a cycle of rumination, and that's driven by anxiety. And it might be that this person is generally quite an anxious person, or doesn't have particularly helpful strategies to manage anxiety, and they're becoming stuck in this state. The fifth way that anxiety shows up in our thinking is through something called depersonalisation or derealisation. These terms fundamentally mean feeling separate and disconnected to. Depersonalisation is feeling disconnected to your mind and your body, like you're not experiencing your own emotions, almost like you're watching yourself from the outside, or just feeling really cut off, like a step away. Derealisation is you just get this sense of feeling disconnected from the world, like you're in a bubble, you're watching everything go by and you can't quite connect it. We know that these two experiences are driven by underlying anxiety. So that was 5 ways that anxiety can show up in our thinking. I've got some other videos of how anxiety can show up in our body and our behaviours and our emotions. If you'd like to hear more about this, please subscribe. My name's Dr. Abigail Pamich. I'm a clinical psychologist and the clinical director of Malvern Hills Private Practice. Thank you for listening.